Welcome back. This is part 2 of the information session for what to expect as a patient with the MaineHealth Weight Management Program. In session 1, we reviewed the disease of obesity and why it is hard to lose weight and why it is important to be aware of the risk for many other diseases if you do carry extra weight. In this episode, we will review the overview, what you should expect from your visits at weight management. Initially, you will need a referral from a provider to start the process to become a patient at the office. This is often your PCP, but sometimes we'll have a referral from orthopedics for patients needing to lose weight before they can have a joint replacement, or cardiology or a sleep doctor hoping to improve their patient's health by working on weight loss. Your body mass index needs to be 35 or higher, which is in at least the class 2 obesity category. The referral should indicate if you are interested in weight loss surgery, medical treatment, or undecided what is best for you. The referring provider will send office notes and recent labs, and we will call new patients to schedule an initial visit. Before your first appointment, you will receive a MyChart message and be asked to fill out questionnaires about your history. If you do not have MyChart, that's okay, but it's helpful if you could try to complete the paperwork ahead of time. The initial visit is either with a surgeon, if you're leaning towards surgery as your preference, or a medical bariatrician if you are not interested in surgery or do not think that surgery is right for you at this time. We will take your vitals and weight and ask questions about your risk for sleep apnea, if not already on treatment, and mood. We will review current medications. The provider will spend time getting to know you and your history of your struggles with your weight, and may review periods of time in your life when weight changed and why. The provider may order labs or a sleep study. If you are planning for surgery, we need to make sure you are up to date with any age-related cancer screenings, such as Pap tests, mammograms, and colon cancer. Surgical patients will need to have stable medical and psychiatric conditions and quit smoking and use of any nicotine products before surgery. An EGD, or an upper endoscopy test, would need to be scheduled for patients pursuing surgery, if not completed in the past few years. All patients who are part of the program are encouraged to meet with one of our registered dietitians. We have group initial sessions via Zoom or in person for the Nutrition Foundations class, which gives patients a basic overview of eating healthier and what to focus on. Almost all patients then come back in person to see a dietitian to discuss their specific concerns, health and dietary needs and restrictions, and come up with a plan to make changes if needed in the diet. This might involve drinking more water or lower calorie drinks, cutting back on simple sugars you are drinking or eating. It may be focusing on increased healthy proteins, vegetables, and fruits. Meal planning, batch cooking, or eating on a budget might be addressed. The goal is to cut back on calories, which can help with weight loss and improved health, but do this in a way which is affordable, reasonable, and can be sustained over time. Exercise or physical activity is important for all of us. When we carry extra weight, it might be harder to move due to increase in inflammation in the joints, arthritis, chronic pain issues, or breathing problems. When you lose a little bit of weight, it can be easier. Ideally, we are all doing 30 minutes or more of activity most days per week, but adding any activity can be helpful. Some studies show the best improvement in health is going from no exercise at all to just 5 or 10 minutes of activity per day. Any activity can help. Chair exercises, housework, walking the dog, being active at work, sports, going to the gym. You don't need to be an athlete to benefit from improved activity. When thinking about activities, the best thing to do is something you like doing. Even better if you're doing it with a friend or family member. It needs to be affordable, convenient, and part of your schedule. Monitoring steps with your smartwatch or phone can be an easy thing to start. Exercise helps you maintain muscle mass when you lose weight, can decrease inflammation and helps with mood, sleep, and even decreases risk for several cancers. You do not need to exercise all at once. Breaking up activity throughout the course of the day might be easier than doing all your activity in one block. Ideally, we are using all of our different muscle groups and varying what we do, as well as combining aerobic exercise that makes our heart go faster and increases our breathing rate with strength training or resistance training to help build muscle. We also need to think about how we stay active in northern New England when it is cold, icy, and snowy out and may not be safe to be doing things outside. Sleep is very important to our health. Most of us need 7 to 9 hours of good sleep at night. Lack of enough sleep over time can increase stress hormones, increase inflammation in your system, and increase risk for medical problems, including depression, anxiety, diabetes, and heart disease. Poor sleep makes you tired, can affect your mood and memory, and can affect your school and job function and even make it harder to lose weight. Just like a baby, if we have regular and predictable sleep routines, comfortable sleeping arrangements, and regular sleep and wake times, we are better rested and able to tackle the day. If not already addressed, we may review your risk for sleep apnea and refer you to a sleep specialist for further evaluation. In addition to seeing a medical provider and dietitian, and perhaps a surgeon, some patients will also see a behavioral health specialist. These might be one-on-one appointments for patient working towards surgery, or could include group sessions to help learn from other patients and work on behavior change. Many of our patients have a history of anxiety, depression, insomnia, or other psychological conditions that can affect their mood, sleep, motivation. And some of the medications we use for these conditions sometimes make us tired and increase appetite, which makes it even harder. Many of our patients see counselors and psychiatrists with whom we are happy to work with towards your goals. We hope to be able to help patients be more aware of their patterns. When they are stressed, sad, mad, or tired, what type of comfort food or drink might you go to, and how do we make changes to make a healthier choice? Small steps is the motto. You can't lose 100 pounds in a week. Being successful at long-term weight management takes a lot of time and effort and baby steps to get there. Weight loss medications and surgeries are tools to help you be more successful, but long-term success and improved health takes a lot of effort and support. A quick note about beverages we drink, which may have 0 or almost no calories, such as water, seltzer, black coffee or tea, or up to hundreds of calories in soda, alcohol, juice, milk, smoothies. A large frozen coffee with whole milk and butter pecan swirl can have 800 calories, which may be close to half the calories you're supposed to eat in one day. This drink also has 179 grams of carbohydrates, which equals almost 45 teaspoons of sugar, which is a lot. Black coffee and tea are probably good for us, so long as the caffeine doesn't interfere with sleep or increase anxiety, but we need to be aware of the significant calories we might be drinking. A typical 12-ounce can of regular soda has about 40 grams of carbohydrates, which is 10 teaspoons of sugar. An occasional drink with extra calories is often not a problem, but over time the extra calories can increase weight and lead to diabetes and other medical problems. The medical provider you will see will review your history of medication use over time and whether some medications may have contributed to increased appetite or weight. Medications like insulin or glipizide for diabetes, some mood stabilizers, some blood pressure medications, and steroids can affect appetite and weight. Medications that make us tired like sleep aids, mirtazapine, antihistamines, such as Benadryl, beta blockers, blood pressure medications may also make it harder to lose weight. If appropriate, we will contact the prescriber of these medications to see if a possible switch to a more weight-neutral medication might be appropriate. In the next section, we will review medications that are used with our program to help promote weight loss.